Hey you guys, so this video that I am making and posting for you guys today is probably at this time the most important video that I have uploaded. And the reason is that it's because about helping people who need certain medications for cancer or heart issues and a few other things too. As far as I know, maybe also arthritis or skin issues. Could be some other things. I'm not sure about all of the medications, but this program that I'm about to share with you today is about helping these individuals get medication that they need, possibly life-saving medication, free of charge. And I am really hoping that this video gets shared as much as possible. I may post it again or post some shorts that connect to this video because it's so important. And if it's you that needs assistance or a loved one or somebody else's loved one or somebody you know that just needs this assistance, I really want to get this information out there because it's these medications cost hundreds of thousands of dollars sometimes. And this is a way to help you be able to get the life-saving medication that you need and not have to worry about the cost of that, especially when you don't have it and especially when we're in such a rough economy. So the program that I'm going to share with you, I created a guide for you and I'm going to go over it and walk you through just the application process to possibly be able to receive this medication for yourself. And then we're going to also go through that application so you can see what it looks like. Some of these applications look a little bit different, but I'm just going to pick one of them and kind of discuss certain things with you because there's certain things that the information is necessary regardless of the application that you're choosing. All right, so without any further ado, I'm going to go ahead and begin. Okay. So the name of this program is Novartis Patient Assistance Program, and I have listed the website, which we're going to go to, and I'm going to just kind of give you a tour of it so you know where to go and how to move and find all the information that you need. I've also listed the phone number for any further questions that you have in relation to it. And who do they help? Medicare, patients who have Medicare, Medicaid, government assisted, TRICARE, DOD, or veteran assistance, and also uninsured. I do apologize for anybody that has commercial insurance. They do not assist with those directly. However, they do have some support. So you can call this number and possibly see if there is any other further assistance that you can get, even though you have commercial insurance. They may be able to point you in the right direction pertaining to some of the medications that they have. I don't know if I said this before, but this is not for all medications. They have a list of medications that they assist with, and you'll be able to see and view that list on the website. But yes, this is a number you can call to see if there's any further assistance that you can get. Here's some other information for my people who have private or commercial insurance. You can possibly talk to, visit or check out Partnership for Prescription Assistance, Needy Meds, or go to Healthcare Gov and Medicare Gov to possibly see about getting any further assistance with medications. Also, there is a copay program for these specific medications that you see here. I've listed the different programs that may have a copay for you that they can help you with here. And you can call and connect. And like I said, I will be leaving an attachment, a PDF attachment in the description of this video so that you can get all of this information and use it for yourself or whoever needs it. All right, so now we're going to talk about the application process. The first thing that you're going to need to apply is your proof of income. Now, the main thing that they take and what they will want, if you file taxes, they want your most recent tax return, and it can't be old. It has to be within the last year. So like at this time, we haven't done 2024 tax return, so it would still be 2023. That's what you would send in at this time. And then if you don't file taxes, but you are getting Social Security award letter for retired or disabled patients, then you would send in that. But that is only if you don't file a tax return. If you get the Social Security award letters for any reason, but you still file a tax return, they want your tax return. And it should be, I'll add that in there. I'm going to add in here that it's the first and second page. Page 1 and 2. All right. Now, if you have no income, then you can call the number at the top that I have listed and ask for an income attestation letter. And you'll get that sent out to you, and you can fill that out explaining your financial situation and you not having income. So no tax return, no recent tax return. And if you want to try and use any other forms of proof of income, you can call them as well. And if there's anything else that they'd be willing to take, if you feel like none of these things fit you, there are things that they may take, but this is the primary stuff. Okay, so proof of income, we've covered that. Next thing is the front and back of your insurance cards, if that's applicable. If you don't have insurance, then you don't have to worry about that. And then the patient application as well as the doctor's application. And this is what we're going to go over when we go to the website. If you have Medicare Part D, there are certain things pertaining to Medicare Part D patients that may end up having them require you to get an extra help denial letter sent in. And I'm gonna go scroll down and show you the information that I've listed where you would call or connect to try to get that extra help denial letter. We'll discuss that a little bit more. Now, if you apply and are denied for income reasons, but you feel like you have some significant change in your income, or you feel like the income that you sent in isn't what your current state of finances is, you can download a denial reconsideration form, and I'm going to show you where that is on the website as well. Okay. Now, I've also listed the income limits for each specific household. Now, household size here is how many individuals live in the house, yes. But when you're sending in, when they're asking for the income for your household size, if there's more than one person here, if you live in more than a one-person household size, does anybody else contribute to the income of your household? So if it's 2 people, do you both have tax returns, or both have Social Security award letters? Or if you have a shared tax return because you're married, then that matters a little bit less because they'll already be on there. But if you have a household size of more than one, then they do want information about all of the income that is being contributed to that household size. At the same time, if you're in a situation where you are renting, let's say you're splitting rent with a friend, but this is really considered a household size to just yourself. If it's not a family understanding, then you would essentially be probably considered a household size of 1 or anything like that. So if you're just rooming with a friend, or you're renting a room or something, but this person isn't considered, they're not putting anything towards your bills or anything like that, then it's not considered a 2-person household or more, or anything like that. This is kind of really based off your family understanding and whatever's going on there. All right, so for some of these medications that are listed, if you are enrolling for the first time, you have to enroll through certain programs that are connected to this foundation, this assistance program. And I've listed all of the specific medications that have that. You must push your application through these programs first before they send it over to Novartis Patient Assistance. So you're going to call this number and discuss getting everything sent in with them. You're going to fax it into them. So that's why I've listed the fax number. Your application is going to go into these different programs first, and those programs are going to send it in to Novartis Patient Assistance. All right. Anything else? Yes. Getting back to Medicare Part D. So for some patients with Medicare Part D, there is certain information that may make it so that you will need to get an extra help denial letter sent in from either Medicare or Social Security. And I've listed the information to call Medicare and see about getting this, or going to the website to see about getting this denial letter in. And it has to be a letter that's sent to you in the mail. I do believe this particular website, or one of these websites, they'll give you, they'll allow you to put in information and determine whether or not you will probably be denied. But they do need a pre-decision denial letter sent from either Medicare or Social Security, or a final denial sent in the mail to you. And once you get that in the mail, then you're going to send it in. And I put the numbers here for Social Security and the website as well, so you know, so you can reach out and see about getting that extra help. Now, if you get a denial from the extra help program, then you can enroll. But if you get approved for the extra help, then you will not be eligible for this program. So that is why they do want you to apply. It could be possible that you will end up getting the extra help. And so that's why they want you to apply first, to see if Medicare will give you that extra assistance. There is information here that says that it's based off a certain income. I have not listed that because from what I've seen and known, maybe you feel that the income you make should fit you getting you not having to get this extra help denial letter, but they still ask for it. So it's best to just go through the enrollment process and see if they're going to ask you to get that letter, or to just go ahead and get it just in case. You know, they, again, like the information that says that it's based off a certain income, it seems like that's not correct for some reason, and you could still end up being asked to provide the extra help denial letter. So it may be best to just go ahead and go through the process of getting it, or if you want to wait and see if they'll ask you to send it in, then you know that's fine too. But even though it's supposed to be based off certain income information, that doesn't seem to be the case. So that's why I left it out. But I do believe that they do have the information on their website itself if you want to look at that and try to go by that. It's just that seems to not be how things are actually being considered. Okay. Now that we've covered all of this, hopefully I went over it well. I did my best, you guys. I'm going to go ahead and go to the website for you. And as I said, I think I mentioned it, but if I didn't, I am going to be leaving this as a link for you underneath this video. Okay, so the first thing that I want to do is showcase to you, well, here it says check eligibility. And this is where you would go to, you know, just kind of find out if you would qualify. All the information that I put for you in that talks about that. If you are uninsured, you would be eligible. If you have commercial insurance, you would not be eligible. If it's based off of your income that you're bringing in your household, you could be eligible or not eligible. You can use this tool to check that if you'd like, but it is on that guide that I just showcased to you. And the only other thing that I want to show you before we take a look at the forms here and the different medications is where you would get the denial reconsideration letter. You would go to frequently asked questions. It says, what can I do if my application is denied? You scroll down to that same question on the frequently asked questions page. And it says, how long will my appeal application take? And you're going to click on this. And this is what you would need to fill out and send in for your denial reconsideration. And you will write in, put in the information, why, and everything else about getting reconsidered. You may have to, they have the application here at this time. I'm not sure, you may have to apply first and send it in. You know, try to apply first, get denied, and then do it, because it is a denial reconsideration application. So go through the process, see if you get denied. If you do, and you feel like the reason that you got denied based off income, if it's something else like you having commercial insurance, then they're not going to change their mind on that. They don't accept commercial insurance. But if it's based off income and you feel like your income is changed, then you can fill this out and let them know that that's the case, and they can reconsider based off that. Possibly it could be 2, depending. Let's say you get approved for extra help with Medicare, but they won't give you extra help with the specific medication that you have. And you can try to send in a denial reconsideration based off the fact that, yes, Medicare is giving you extra help, but it's not extra help with the medication that you are trying to get with them, and that may get you approved. So that's something to consider as well. All right, now guys, I'm going to move on to the forms, the patient application and the doctor's application. But first, you see, this is the list of medications here. You can go here and try and see if any of these medications are ones that you need or use, or somebody uses. They have quite a few here that if you are paying out of pocket, or you feel like you can't afford it, or whatever the case may be, you feel like it's not covered, you can try and get assistance with this process. So what you're going to do, you're going to click your medication, whatever one that is, and it's going to have an option to download and complete this form. And here's the application. First thing we're taking a look at is the patient application. You would fill out your name, all the pertinent date of birth, email, phone number, address, all of these things. This is where your household size would go. Put that information there. And this line is important, where it says caregiver name. Now, if you want a specific person to call in for you, or let's say you can't call in and get a refill on your medication, and you want your spouse to call in for you, they can't call in and get a refill on your medication for you if they're not listed here without your permission. So it's important for you, if you feel like you're going to have somebody else that may be taking this action for you to get refills on your medication, or to take a look and see what's going on with your case, or whatever the case may be. It's important for you to have whoever you feel is going to be connected to that or doing that with you down here. If it's a family member, daughter, son, brother, spouse, whoever it is, make sure you put that information in there so they won't run into any issues when they're trying to get information on your case. If there's no information there, then they would need to have you in the room to give permission for them to speak about whatever's going on with you medically in relation to this. If they aren't there, their name is not on this line, then, and you're not around, then they're not going to be able to get assistance. So it's important for you to make sure that if you feel like there's anybody that fits that bill, you put their name and their information here. And as you can see, I did talk about the front and back insurance card, sending that in, but you can also write it in on the application as well. Send in a copy, but write it in the application for you. They ask about your employment, and income here as well, and the signature and date. And then you have the doctor's application. Now, they would need to put in their name, the address of the practice, and it's very important that they put the phone number and the fax number, both of those things, because this program, Novartis will be wanting to call them in relation to your case, and also possibly to be sending fax information to them. They need that. And if it's not on there, then it can slow down the process of your application getting approved. They have to have this information. And this right here is very important too. The provider's MPI number is basically like a doctor's serial number, proving that the doctor is who they say that they are. And this information needs to be there. If it's missing, again, it'll slow down your application process. And then there's the patient information here for you that matches this up to your patient application, the prescription information for whatever medication you're receiving. And that is pretty much it. We have the provider's signature and date at the bottom, but that's it. It's pretty straightforward. As I said, the only other thing that you may need is, if you have Medicare Part D, is you may need to have that extra help denial letter sent in. But that's pretty much it. And if you go through this process, you fit all the requirements, then you probably will get approved to get that medication, or one of the medications that they have as a part of their program. Because again, they have a list of medications that are part of their program, and that's what this is for. But that is all, you guys. I really hope this information was helpful to you, and I hope I did a good job explaining it. But if not, you can call them. I do have this guide, and I hope it is clear enough for you to be able to go through this process. But yes, you can also just call them and have them explain it to you if I did a poor job explaining it. And I hope again that this is something that helps you or saves somebody's life, because again, some of these medications, they are life-saving. So if you can share this information, get it out there. I don't care if you share the video or just share the guide I sent. I'm linking here, but this information is important for anybody who is dealing with a lot in relation to their health. I've in my own life experienced loved ones who've had health issues and expensive medication that was hard to for them to get and things of that nature. So if this can be of assistance and helping somebody else's loved one get medication free of charge, I really would like it to be. But again, that's all I have. I hope it assists someone, and I'll talk to you guys later.